So just to tell you a little bit about the place that I work, the Center for Women's Aesthetics, we are a small, intimate practice. We're located in Uptown Charlotte. We're about 1.5 miles up the street from the Pink House going towards Uptown. We have both a medical side where we do our Mona Lisa procedure, and we have an aesthetic side where we do everything facial and skincare. So we get a lot of people that come for one or the other and end up overlapping with us. So we have a beautiful little office here. It's very small and intimate. We opened about almost 4 years ago. We have 2 nurse practitioners. The other girl is Candace Kessler, who could not be here tonight, unfortunately, but she's an OBGYN nurse practitioner. And then, as Leslie said, I am a family nurse practitioner with a background in female urology. So when I started this job a few years ago, it was sort of right up my alley from all the things that I had been dealing with ladies with vaginal atrophy. So it kind of all worked out really well. So we have a medical director here who is a urologist. He's not with us all the time, but he's available 24/7 when we need him. So we refer to him if something comes up and we need his input. Otherwise, Candace and I are the 2 that do the procedures. And then we don't require a doctor's referral here. So you can refer yourself. That's never a problem. We do recommend that you have had a GYN exam within the last 12 to 18 months before seeing us here. So I'm going to talk a little bit about vaginal atrophy because that's what people with breast cancer who have been through treatment as well as postmenopausal women are experiencing. So we'll talk about that. Feel free to interrupt me at any time with a general question. If you have a more personal question, just ask me at the end. And then we'll go into talking about the Mona Lisa procedure. So, excuse me. So vaginal atrophy is a term that refers to the vaginal changes that occur following menopause or due to declining estrogen levels. So it can be, really, it can start during the perimenopausal phase, which is up to 10 years before you actually go through menopause, or it can come on after menopause. It can come on from breast cancer treatments, chemotherapy, pelvic radiation, having your ovaries out. So there are several things that bring atrophy about. It's very common. About 50 to 60% of women who are postmenopausal experience atrophy, and that number can be even higher in women with breast cancer. So it's a very common problem, and a lot of the women that I see here are breast cancer survivors. So other people who are at risk for atrophy are people who smoke because their circulation is not as good as someone who is a non-smoker. They have less oxygen in their bloodstream, and that sort of affects our hormone levels. So that puts them at more at risk. Also, being on tamoxifen, those type of drugs, those estrogen blockers also put you at risk. And then ladies who have not been sexually active for an extended period of time can also be more at risk for atrophy. So the symptoms that you experience with that are vaginal dryness, painful intercourse, any kind of vaginal symptoms such as itching, burning, irritation, bleeding after intercourse. Those are some of the common symptoms that we see. You also may get, the vagina loses the elasticity. It's actually a muscle that has to be used or you lose it. You've heard that term before, but the same thing applies. In women that don't have intercourse, the vagina is not getting stretched out, so it becomes very small and tight, and that tissue becomes very thin, and it just doesn't stretch out. It doesn't accommodate a sexual partner, so that can be a huge problem for people, and it can affect their relationships as well as their physical health. So when we do an exam, what we see are changes in that vaginal tissue. So the tissue becomes very thin, pale looking. Normally the vagina is a nice pink moist appearance, and it will lose that appearance completely. It can be very pale and almost a white color. It can also become red and inflamed just from inflammation, irritation. So those are some of the things we see. The tissue will look very dry. If you take a speculum and look up inside, then you can see changes that occur inside the vagina where normally there are a lot of folds up inside, and those folds, you kind of lose those folds. So everything becomes really smooth. The vagina doesn't stretch out as well, so you get little tears that can occur with the intercourse or even from just wiping. So treatment for vaginal atrophy is sort of a stepwise thing. People start with lubricants during intercourse. They can use vaginal moisturizers or coconut oil, and those kind of things can be helpful in the short term, but long term, they're not going to really improve that integrity of that tissue. So a lot of women take oral estrogen or use an estrogen patch, and they think that that's going to help with the vaginal symptoms, and that's going to be more protective of your bones. It's going to help with hot flashes, sleep disturbances, but it doesn't really help locally in the vagina. So the next step is using some vaginal estrogen preparations. These are called topical estrogen. So it's either vaginal creams, suppositories, little tablets. There's even a ring that can be put up inside. Your doctor places that ring. It's an estrogen ring, and it releases estrogen over 90 days, and then you change it out every 3 months. So those are topical estrogens. There are other preparations such as intrarosa, which is DHEA, which is a hormone that the body produces. So intrarosa is a plant-based product, and it affects hormones. So it sort of affects estrogen and testosterone. So it's probably not a good thing for people with breast cancer to use, but it is another one of the options out there. And then there's another product called Reverie, which is an over-the-counter product, and this is hyaluronic acid. So if you've seen commercials for facial moisturizers that contain hyaluronic acid, this is essentially the same thing. And hyaluronic acid is actually produced in our bodies. It's a sugar that's produced in the bodies that helps to lubricate the joints in the body. It's also what we use when we do fillers in the face or the lips. So it draws moisture, so that helps to bring water to the vaginal tissue. But again, it's not a long-term improvement. Then another thing some women do is use vaginal dilators. These are usually prescribed by your doctor. They can be purchased on Amazon, just like everything else in the world can be purchased on Amazon, but they're graduated cylinders. They're usually a rubber type or a silicone type tube like dilator, and they come in different sizes, and you can use those to help stretch the vagina out. Particularly somebody who's not sexually active might benefit from using those. And then if all else fails, they're vaginal lasers. So that's where the Mona Lisa comes in. So before I get to that, does anybody have a general question about atrophy for me? Okay, all right. Interrupt me at any time if you do. So the Mona Lisa is the laser that we have here at the Center for Women's Aesthetics. It was the first vaginal laser to come out. It originated in Italy for women with breast cancer who needed an alternative to estrogen therapy. So now it's used on anybody who's having symptoms of declining estrogen, whether it's post-menopausal, naturally, from having your ovaries out, from going through chemotherapy or breast cancer treatment. So it's used on anybody who is having those type of symptoms. It was the first vaginal laser to be used worldwide. It's been out, it originated there about 15 years ago. It received FDA approval in the US 6 years ago. So we were the first people in Charlotte to have it, and we've been open about 4 years. And in that time, we've done about 3,000 procedures. So we do a ton of these, and we get excellent results with it. So there are other lasers and platforms that have come out since that time. They, some of them are lasers, some of them are radio frequency. So if you are looking around and thinking about doing something like this, I would advise against doing radio frequency just because it's not as well controlled. The heat, you can't control the heat to that tissue. So you run a higher risk of having burns or, you know, adverse events. So Mona Lisa, with all the lasers that are out there, Mona Lisa is still considered the gold standard of all the lasers. One thing it is not is vaginal rejuvenation. Although it essentially does rejuvenate that vaginal tissue and make it healthier, the company that makes this laser, Cynosure is the name of the company, they do not market this for sexual improvement or for tightening effect. Although that you may get both of those as a result of the Mona Lisa, but it is not marketed for either of those uses. So it is a CO2 fractional laser. So that is the same type of laser that women get on their face to build collagen. It does the same thing in the vaginal tissue. So it creates little tiny microscopic channels or wounds, so to speak, in the tissue. And then when they heal, they grow new collagen, elastin, and blood vessels. So that tissue becomes thicker and healthier and more lubricated. And so over time, when that collagen rebuilds, the tissue is just much healthier. If you look under the microscope, even 2 months after having had one procedure, there's a significant difference in the thickness of that tissue. And then the lubrication, the Mona Lisa does not affect your estrogen levels. So it doesn't play a role in lubrication from estrogen, but it rebuilds little capillaries in the tissue. And that's where the lubrication comes from, is just sort of seepage from those capillary vessels. So we do 3 treatments at 6-week intervals. We do both an internal and external treatment every time. We find that you get a better result that way because you also lose collagen in the urethra, you lose collagen in the labia and the vulva. So it just helps to make everything healthier. So we do this for not only dryness, painful intercourse, and those symptoms, but we also treat a couple of other things with the laser. We treat a vulvar skin condition called lichen sclerosis, which is an autoimmune disorder that affects the vulva. It makes the tissue very thin and causes pretty significant symptoms of itching and burning. So that's another condition we treat. It's used off-label worldwide to treat that. It's not FDA approved for lichen sclerosis in the US, but it is used. And then also, as another benefit of the Mona Lisa, it affects the urinary tract. So you get improvement in frequency, urgency, and incontinence. And those are also symptoms that come along with menopause, just from losing that estrogen in the urethra. So when we, well, I will say, as far as ideal candidates for it, it's anyone with declining estrogen levels, a breast cancer survivor, post-menopausal, anyone with overactive bladder. I get a lot of patients who are referred to me strictly for urinary incontinence. And although it's not FDA approved at this time for incontinence, they are actually going through the process right now through the FDA. So we hope that by the end of the year, we'll have that indication as well. There are a group of people that we cannot do Mona Lisa in. Those are people who have undiagnosed lesions of the vagina, the cervix, or the vulva, need to be seen by a doctor, make sure that those are not cancerous lesions before we treat it. So, you know, once you have a diagnosis and we know that everything is okay, that can be treated. Any kind of active infection like urinary tract infection, vaginal infection, herpes, you have to wait until that's resolved. So, you know, a week or two after your infection is resolved, we can do that. Also, pregnant women, not that we get a lot of pregnant women in here with atrophy, but pregnancy or being up to 3 months postpartum is a contraindication. People who have had pelvic radiation for, say, rectal cancer or cervical cancer, it is a contraindication. However, we can actually make some adjustments to the machine, turn the energy down a little bit, and we can treat patients with radiation. And I've actually treated 2 who did remarkably well. Another contraindication is if you've got a prolapse where things are falling, your bladder, your rectum is falling, as long as they're not coming out the vagina, we can treat that. So we have to see you, do an exam, and make sure that the prolapse is not too significant for me to treat. And then people who have had vaginal reconstruction, where if you have had a big prolapse and you've had surgery that used mesh in the vagina, that cannot be treated if it's synthetic mesh. And so that's another thing that we evaluate at the assessment. People who have had just a little sling procedure to pull the urethra up for urinary incontinence, we're good to go with those, so they can be treated. But again, we do the 3 treatments at 6-week intervals. We do both internal, external. When you come in to see me for the first time, I'll do a medical history, I'll do an exam, then we'll put some numbing cream on the outside and we let that sit for about 15 or 20 minutes before we get started. Then when I come back in, we all put our glasses on. So anybody who's getting the laser in the room has to wear these lovely glasses to protect your eyes, because the laser can damage the cornea if you were to look at it when it was firing. So that's just a safety mechanism. When I do the vaginal portion, there's not a lot of nerve endings in the vagina, so you don't feel pain with it. You feel more of a, just kind of a strange vibration feeling, even a buzzing sort of feel. I've had the Mona Lisa done. I know what it feels like. It's the best way I can describe it is just a really weird feeling, but it is not painful. It takes me about 2 minutes to do it, so it's super quick. Then let me show you my probe here so you can see this. This is the vaginal probe, and I've got 2 different sizes of these. So we put this probe in as far as it goes, which is typically to one of these 2 numbers down here on the end. We treat 360 degrees at that mark. I pull out to the next, I do the same thing. So we're doing that all the way out the vagina. Even though the energy is focused at this mark, and so really only 10% of the vaginal tissue gets actually treated by the laser, there's enough energy that it spreads throughout the tissue so that in the end, all of the vaginal tissue is treated. So you're going to feel that vibration feeling through here. When I get to the last 2 marks that are right about the vaginal opening, that feels a little bit more uncomfortable, not painful, but just a little bit hot and burny. So then when I'm finished with that, in about 2 minutes time, I change over my probes, and then we do the outside. And for that part, you're numb from that numbing cream. So really don't feel much discomfort with that at all, unless I just happen to hit a little spot that didn't numb up as well, or has more nerve endings in that area. Then you might feel a little rubber band feeling. And if any of you have ever had a facial laser, you kind of know what that feels like. This is probably not as bad as a facial laser because I've had both and I can vouch for it. But this is my external probe. So we put the prongs right against the skin and the laser fires right through the end of that. Don't feel anything due to the wonderful numbing cream we use. And that also takes me just a couple of minutes to do. Then when I'm finished, I'll put a cold washcloth on there. I'll let that sit for 5 minutes or so. I'll put some more creams on there before I let you go. And then I send you home with a little ice pack that will be your best friend for the next few hours. This is a little gel pack, and you can just put this in your pants. Nobody even knows you have it in there. And that just helps to prevent swelling. You will feel a little swollen and a little burny for the first few hours after. So that really helps to calm that down. I also give numbing cream to have on hand if you need it. Some people use it, some people don't. And it's just good to have that on hand. I also give Aquaphor ointment, and that's what you're going to put on the outside for 2 or 3 days, just till that skin heals on the outside. And if you were to look at the tissue, you're not going to really see anything. It might look red and a little swollen for a few hours, but that goes away quickly, and you're not going to see anything. You're not going to see these little wounds that are created by the laser because they're microscopic. They're teeny tiny, so they're not visible. Other post instructions are you cannot take a shower for 24 hours after, just because we don't want you to get hot water on that treated skin. And then we tell people not to take a bath or go swimming for 5 days after, just so you're not in dirty water that could potentially lead to an infection. Let's see, also no strenuous exercise, no biking or running for about 2 days. And the only reason we tell you that is because if you go out there and you do some exercise for 30 minutes or an hour, it's going to get your heart rate up. And if you do that, it's going to make you swell. So that's the only reason. Otherwise, you can walk, you can do yoga, you can do light weightlifting, the things that you enjoy doing. But we just ask that people hold off on running or biking for 2 days. And then no intercourse for 7 days after. And people who are using vaginal estrogens or any kind of vaginal medication, we tell you not to insert that for 48 hours prior or after the procedure. Then the symptoms or the side effects that you will feel afterwards are a little bit of itching, irritation. You will have a little burning when you urinate the first 2 or 3 times that day, but then that resolves. You may have a little bit of spotting that can last for 24, 36 hours afterwards, but it's usually very minor. And really that's all the side effects that people report. Occasionally somebody will get a yeast infection a few days out, but that's very, very rare. There have been no long-term side effects reported with the Mona Lisa. It is a very safe laser. It's got technology that keeps it from burning the tissue. It knows the exact depth to go in the tissue. So they call it smart side technology, and it really is a very smart laser. So there have been no reported long-term effects worldwide from this laser, which is a good thing. That's very comforting. And then results are typically seen within about 2 weeks after that first procedure. That's in the majority of patients. I would say 60 to 70% of people will see improvement that quickly. But when you come back for the second procedure, I turn the energy up, so it's a little bit stronger treatment. And we stay at that level at for the third treatment as well. So that's where that really good collagen growth comes from. Now, there have been numerous clinical studies done on the Mona Lisa to show effectiveness, patient satisfaction, and they studied effectiveness in all different areas, whether that was looking under the microscope and seeing the thickness in that tissue, whether it was patient reports of dryness, painful intercourse, urinary incontinence. They've studied numerous things. And all of those studies have shown greater than 90% satisfaction rate. So it really is safe, effective, and it just works great. All of those clinical studies, they're kind of boring to read, but if you wanted to read them, they are on our website, and I'll give you our web address here when we get finished in just a few minutes. And then as far as follow-up, we plan to see you, or after we finish your 3, I'll give you a call on the phone and we talk in about 2 months just to make sure that all is well and you're happy with your results, then we plan to see you back in about 1 year to do just a one-time annual treatment. And that's sort of a maintenance treatment so that you maintain the results that you got from your series of 3. The clinical studies did show that the results start to decline at about 18 months out from your 3. So it is recommended by the company that makes the laser and by sort of patient experience that we do a touch-up treatment at around a year. And I will frequently call people at a year's time and say, it's time for you to come in. And a lot of women will say, I'm still doing well, I don't need to come in yet. But I do encourage them to come before the 18-month mark, because I think you will see a decline in the symptoms. And, you know, if you stay ahead of it, you're not going to have to repeat a series of 3. You're just going to have that one treatment done. And I know the most important question of all is cost. That's what everyone wants to know. So unfortunately, Mona Lisa is not covered by health insurance. Don't ask me why. I don't know why. We've been waiting ever since we opened for insurance companies to start covering it. But it's, in their eyes, considered a cosmetic procedure, even though Mona Lisa is a medical procedure. So hopefully sometime down the road there will be coverage for it, but right now there's not a CPT code, which is the procedure code that is used to turn something into an insurance company. So our cost for the 3 procedures is $18.99, and we offer a 20% discount to any cancer survivor. So the cost for those 3 treatments drops from $18.99 to $14.39. So it's a pretty good savings. And then the annual treatment is normally $500, and you get the 20% off that as well. So it becomes $400 for that cost of that. And that is basically Mona Lisa in a nutshell. I do want to sort of show you my room, if I can do that without dropping anything or making you all dizzy. But so when you come in to see me, if you can see that, this is my exam table. It's a very comfortable table. It's looks like the kind of table you're going to have a baby on, but I promise you it's really, really comfy and padded. And then this is the Mona Lisa machine right here. So can you all see that okay? Okay. So that's really it. So tell me what questions I can answer for you all.